Not so long ago, the veterinary profession declined to take pain in animals very seriously. If pain was acknowledged at all, it was often within the context of treating post-operative pain as a way to keep animals quiet. In the 1980s, it was often thought that if post-surgical pain was removed, animals might move around too much and damage their incisions. L. E. Davis, a veterinary pharmacologist, stated in 1983, quote, "One of the curiosities of therapeutic decision-making is the withholding of analgesic drugs, because the clinician is not absolutely certain that the animal is experiencing pain. Yet the same individual will administer antibiotics without documenting the presence of bacterial infections. Pain and suffering constitute the only situation in which I believe that if in doubt, one should go ahead and treat," unquote. Public perception of pain, and specifically of animal pain, has increased dramatically over the past decade. Veterinary clients are much more aware of pain as an issue for their pets, and they want to do whatever is necessary to relieve it. Leon Bernard, a French physician from the 15th century, said that medicine should be practiced as a form of friendship. In human medicine, the Joint Commission for Accreditation of Healthcare Organizations has elevated pain to the 5th vital sign to be measured alongside temperature, pulse, respiration rate, and blood pressure. This strategy is one that veterinarians must now consider for the health and comfort of their patients as well. Pain, as defined by the International Association for the Study of Pain, IASP, is an unpleasant and emotional experience associated with actual or potential tissue damage. The IASP also states that the inability to communicate in no way negates the possibility that an individual is experiencing pain and is in need of appropriate pain-relieving treatment. The current method of caring for a human patient with multiple issues and problems is a multidisciplinary approach. A variety of medical specialists are recruited to care for the individual. Each specialist has his or her area of expertise. However, despite a concerted effort, the participants in the group are most often not communicating among themselves. In veterinary medicine, our approach to complex disease states still tends to reflect a multidisciplinary approach. The primary care provider uncovers a diagnosis of cancer, and the patient is turfed to the oncologist. The client and the patient go to the specialist's facility for treatment, and then, like a ping-pong ball, bounce back to the primary care practice afterward. Similar scenarios emerge in advanced orthopedic cases. In general, most of the communication comes after the fact, and is not in the form of a dialogue during the animal's care. A more desirable alternative is an interdisciplinary paradigm. In interdisciplinary care, the patient is at the center of the caregiving circle, and the professionals involved communicate with one another. For animals in pain, this means engaging the entire team in the ongoing assessment and management of a particular patient. Pain patients provide an excellent opportunity for an increased level of participation in patient assessment and care on the part of the credentialed veterinary nurse, veterinary assistant, as well as other members of the veterinary healthcare team. These patients need and deserve as much support and ongoing assessment as we can provide them. A practice team can ramp up their pain management activities by belonging to the International Veterinary Academy of Pain Management. The IVAPM is an interdisciplinary veterinary organization dedicated to improving the identification, prevention, and relief of pain in animals. The Academy brings together individuals from a wide variety of allied professions to exchange information relevant to animal pain. The International Veterinary Academy of Pain Management seeks to improve the standard of care for treating animals in pain by developing guidelines for care, providing continuing education, promoting humane and ethical research in animal pain, and by establishing credentialing of veterinary specialists in the area of animal pain management. In the next section of this program on pain management, we will discuss the two major categories of pain, acute and chronic.